It's one of the most terrifying moments a parent can experience. Your child is crying, maybe from a little bump or a burst of frustration, and then suddenly, they fall silent. They may turn blue or pale and then they pass out. It looks like a major medical emergency. But what you've likely witnessed is a common and surprisingly benign event called a breath-holding spell. It's scary, but it's important to know you're not alone. These spells affect up to 1 in 20 healthy children, typically starting between 6 months and 2 years of age. And here's the most critical part. These are involuntary reflexes. Your child is not doing this on purpose, and they have absolutely no control over it. It's not a behavioral issue or a sign of defiance. It's a physiological reaction. So what's actually going on? There are 2 main types of these spells, and they have different triggers. The first, and most common, is the cyanotic spell. Cyanotic just means turning blue. This type usually follows a moment of intense anger or frustration. Maybe your toddler wanted a cookie before dinner and you said no. The tantrum starts, the crying escalates, and then after a forceful exhale, they stop breathing. Their face, especially around the lips, will turn a bluish or even purplish color before they lose consciousness. This one is less common and is triggered by a sudden fright, shock, or a painful experience, like a fall. Instead of turning blue, the child becomes extremely pale or white. This happens because the shock causes their heart rate to slow down dramatically for a moment, reducing blood flow and leading to the fainting. For a parent, seeing your child turn either blue or ghost white is incredibly alarming, but understanding the trigger can help you make sense of what's happening. Now, let's talk about what the spell itself looks like, because this is where a lot of the fear comes from. Whether it's a cyanotic or pallid spell, the child will lose consciousness. This usually lasts for less than a minute, though it will feel like an eternity. In some more dramatic cases, their body might become stiff, or they might have some brief, jerky movements. This can look terrifyingly like a seizure, and in a way, it is one. It's called an anoxic seizure, caused by the temporary lack of oxygen to the brain. But here's the good news, and I really want to emphasize this. These spells are benign. They do not cause brain damage, epilepsy, or any other long-term neurological problems. After a short time, usually 30 to 60 seconds, the body's automatic breathing reflexes kick back in, and your child will start breathing again and wake up, often feeling a bit groggy or tired. Knowing what to do when a spell happens is key to managing your own panic. The most important thing you can do is stay calm. First, if your child had food in their mouth, quickly check to make sure their airway is clear. Don't put your fingers deep into their throat, just a quick look and gentle sweep if you see something. Next, lay your child down on their side, preferably on a soft surface like the floor or a rug. The side position helps keep their airway open and prevents them from choking if they happen to vomit. Clear the area around them of any hard furniture or sharp objects to prevent injury. Now, what not to do is just as important. Do not shake or slap your child to try and wake them up. Don't splash water on their face or try to force anything into their mouth. And critically, do not start CPR unless they have stopped breathing for more than a minute and haven't started again on their own. In the vast majority of cases, they will. If, however, your child stays blue or doesn't resume breathing after a minute, that is a true emergency and you should call 911 immediately. So why do some children have these spells while others don't? The exact cause isn't fully understood, but it is thought to be related to a temporary glitch in the autonomic nervous system, the part of the brain that controls involuntary functions like heart rate and breathing. However, researchers have found a very strong link between breath-holding spells and iron deficiency. In fact, many children who have these spells, even if they aren't technically anemic, show significant improvement when they take iron supplements. Your pediatrician can run a simple blood test to check your child's iron levels. If they are low, starting a supplement under your doctor's guidance could dramatically reduce the frequency and severity of the spells. For very severe and frequent cases, some studies have shown that a medication called pyricetam can be effective. But this is something that requires a consultation with a pediatric specialist and is not a first-line treatment. Can you prevent them from happening? This is a tricky one. Since the cyanotic spells are often triggered by anger and frustration, you might be able to head one off by distracting your child before a full-blown tantrum begins. Recognizing their early frustration cues and redirecting their attention can sometimes work wonders. However, and doctors are very clear about this, you should not give in to tantrums just to avoid a spell. It's a tough line to walk, but children still need consistent boundaries and discipline. Giving in to every demand to prevent a spell can create long-term behavioral problems. The best news of all is that children outgrow this. Breath-holding spells almost always disappear on their own by 5 or 6 years of age. Long-term studies show that children who have these spells develop just as normally as their peers. Interestingly, they may be slightly more prone to fainting spells as teenagers or adults, but that's about it. To wrap this all up, if you witness what you think is a breath-holding spell for the first time, it's essential to see your pediatrician. They need to confirm the diagnosis and rule out any other more serious underlying conditions, like a heart issue or an actual seizure disorder. But once it's confirmed, you can be reassured. While these moments are undeniably frightening, they are temporary and not harmful to your child's health or development. With a little knowledge, a calm response, and support from your doctor, you can navigate this phase safely until your child leaves it behind for good. Thank you for watching. Please give it a thumbs up and subscribe.